Hey guys, do you have pain with your sit-ups? Many times that's because you're doing them wrong. We are going to show you how to do them the right way today on the Formative Fitness channel.
If you are feeling pain during crunches or sit-ups, you just suck.
Rah!
If you are feeling pain during crunches or sit-ups, you're not alone.
Thank you. The good news about this issue is it's relatively straightforward and easy to fix.
So stick around for this video to find out how not to suck.
Rah!
To permanently banish your lower back pain.
Sit-ups historically have been labeled as like crunch's more dangerous big brother. But since you need this movement pattern in everyday life with things like getting up out of bed or playing with your kids in the grass or playing with your animals, or really any time you need to get up off the floor, it makes it an essential movement pattern that you need to master.
So keep watching and we'll show you where most people go wrong with the sit-up and how to do them properly to increase the benefit and decrease the risk.
The first step for eliminating lower back pain with a sit-up is really understanding what's happening at your spine when you do one. I need a spine. Is there a spine anywhere?
Heads up!
Oh. All right, we got a spine. So there's really two different muscle groups you need to keep in mind when you're doing a sit-up. The first one is your rectus abdominis muscle group, and that's what most people think of as like their six-pack muscle. That one's pretty simple. It connects up into the kind of bottom part of our sternum at the xiphoid process and into some of the cartilage at the area of the ribs, and then all the way down into the front of the pelvis at the pubic symphysis. And that muscle group mainly produces flexion at your spine or resists extension eccentrically. The second muscle group is much more interesting in how it interplays with a sit-up and really is the pesky one that might cause you pain. And that's the iliopsoas muscle group. This muscle group is the one that most people think of as the hip flexor, and it has some really interesting connections and insertions origins. So the psoas component connects into T12 on the front part of the spine and then down into all of your lumbar vertebra. So it's connecting on the abdominal side of your lumbar spine, and then the iliacus component connects on the fossa of your pelvis, and then those two muscles merge and connect onto your femur bone at the lesser trochanter. So it is a really kind of interesting that it goes all the way back to the front of the spine and then to the front of the hip or the femur muscle, and it connects that kind of, it almost knits your body together. That muscle group typically produces flexion and extension at your hip.
Boss, were you speaking English for that whole time? Because I'm pretty sure that
English. I think everybody, but did I need to simplify it?
Oh my God, nerd, yes!
Oh God. Okay, let's simplify that. Okay, so I'm gonna try to simplify this a little bit. So think of muscles like rubber bands. So the rectus abdominis, when that one contracts, it's going from that top or bottom part of your sternum to your pelvis, and it's pulling down, creating flexion at the spine. It also produces a posterior tilt at your pelvis when it's doing that particular motion of the sit-up. The iliopsoas group, when it attaches from the front part of your spine onto the femur, and that pulls, when that muscle contracts, it's actually pulling that spine into an anterior tilt, or the pelvis into an anterior tilt position. So it's really that interplay between the two different muscle groups producing opposing forces at the spine of where people get into trouble with their sit-ups. So the most important part with the sit-up is that you get the correct balance of activation at the iliopsoas muscle group and the rectus abdominis muscle group. They have to really work together as a team. So Rock and I are going to show you an example now of what it looks like when those two muscle groups are not playing well together, and then we're also going to show you an example of what it looks like when they're doing a great job.
Oh, I have to actually do sit-ups?
You got to do sit-ups, Rock. All right, let's go. All right, in this first example of a sit-up, we're going to show you what it looks like when there's too much force going through the iliopsoas muscle group and not enough force going at the rectus abdominis muscle group. All right, so what you're going to notice as Rock comes down, he's going to hit with a flat back. Smack. So his whole spine is pretty much almost in a fully extended position at the bottom, and that's where you're going to feel pain. Let's do another bad one, Rock. Coming down, pretty much extended at that lower back, smack. So what should happen when you're coming down and you're getting a nice interplay of those two muscle groups is that you roll through your lower back. So you should hit in a flexed position, roll through smoothly, almost releasing down each vertebra at a time. Rolling through. One more time, sir. That's actually pretty good, Rock.
I'm a professional.
I can tell.
So now we're going to show you a drill to work on sequencing those muscles appropriately, because many times, especially when someone's starting out and they're trying out a sit-up exercise, they might not be strong enough in that abdominal muscles to counteract the force coming from the hip flexor. So the way to do this, it's really simple. All you need to do is grab a band, attach it in front of your body. So you want to attach it in the front, then extend your arms all the way out. And then what the band is going to be, it's going to be like your little helper on the sit-up. So as I'm coming down, I can really force my lower back down, rolling through that lumbar spine first, thoracic spine, and then through the cervical spine. And then reversing on the way back up, tucking the head, rolling through the thoracic spine, through the lumbar spine. So it's a nice, smooth motion. And I find with my clients or my patients that adding a little bit of assistance to it, it either sequences them right so they get the motor pattern correct and or gives them that little bit of help that they need to get the form down so that they're able to do that motion of the sit-up without pain and do it properly. The other thing with this drill is it's very scalable, meaning that as soon as you can do it appropriately with a medium level band, you can then go down to a smaller, lighter band and do it with something like that to add in less resistance and then work your way up to the full sit-up or even weighted sit-ups. All right, guys, hopefully that kind of clears up some of the issues that maybe you've been having with your sit-up. So either a motor control issue between those two muscle groups or maybe just a weakness issue. Try out that drill. I think it'll be very, very helpful for you. Pretty much every client or patient I've used that with, I've been able to get them doing a sit-up pain-free and in good form. Nerd. All right, thank you. Please subscribe, give us a thumbs up, hit the notifications button, and we'll see you again soon.